IVF is in vitro fertilization, where the fertilization of the egg with the sperm is done outside the body. Now, why this IVF incidence is increasing day by day? Because many couples are facing problem in conceiving naturally, and even though they try intrauterine insemination, which is the first step of the infertility treatment, and suppose if the pregnancy does not happen even with the intrauterine insemination, then they are asked to move on for IVF. So, IVF is a conventional term where we take the eggs out and eggs are fertilized with the sperm in a petri dish. And if you go try to understand what are the steps of in vitro fertilization, then first important step is when the patient comes to us in the OPD, and based on the medical history and all the reports like blood test reports, the variant reserve, the tubal factor, or the semen parameters, when we advise them to go for IVF based on the factor which is affecting the pregnancy, out of which the most important is the age factor, the low variant reserve, or the tubal factor, where the one or the both the fallopian tubes, they are either unhealthy or they are blocked at some point, or the semen parameters are below the normal range. So, in those cases, we ask them to move on for IVF. So, basic tests are done, and once the basic tests are normal, then as soon as the bleeding starts, so from the second day or third day of the cycle, the injections are started, and these are the hormonal injections. So, why hormonal injections are given? This is to increase the number of the follicles. So, whatever the ovarian reserve the patient has, the basic aim of these injection is to form multiple follicles so that we have at least 4 to 5 eggs to fertilize. And when the follicle size they reach to 18-19 millimeters in size, we take the eggs out. Once the procedure is done, then they are discharged 2 or 3 hours after the procedure. Now, because this is done under general anesthesia, so it's a painless procedure, and it is done under ultrasound guidance. The needle is introduced through the fornix, through the vagina, to the ovaries, and we take the eggs out. So, there is no cut, no stitch. Because there is no cut, no stitch, and it's a painless, so the discharge is also on the same day. The patient is not advised to stay overnight. The same day, we ask the husband also to give the semen sample. The semen sample is prepared, it is processed so that we have good motile concentrated semen sample, and where we select the sperm, or when we do the IVF, we place the eggs in a petri dish along with the semen sample and leave them to fertilize on their own. We check for the fertilization after 70 to 18 hours or the next day, and depending upon the number of the embryos fertilized. So, the next day, the fertilization is checked when the embryos are grown in the lab for 3 to 5 days, and the good embryos, they are either frozen or they are transferred into the womb. So, basically, not more than 2 to 3 embryos are transferred inside the uterus. It depends on the patient age, the previous medical history, and the other features, like if the patient is not associated with any other medical problem, then we can transfer up to 2. Otherwise, usually the 2 embryos are transferred, and rest of the good embryos, they are frozen for later use. After the embryo transfer, they are prescribed certain hormones, injection, and the medicines, and 2 weeks later, they are asked to do the pregnancy test. So, this pregnancy test tells us if the patient is pregnant or not. Now, after the embryo transfer, it's not necessary that patient has to be on complete bed rest. They are advised to have normal movement, to carry on all the normal routine activities, and to have the normal well-balanced diet. To follow the doctor instructions strictly and sincerely, and if there is any problem they face in between, then they always have to report to the treating doctor. So, this is the advice which is usually given to the patient after the embryo transfer. Some patients, they feel that taking the complete rest or eating certain things or avoiding certain things will help in chances of pregnancy. That's a myth. So once we know that the patient is pregnant, 1 week later, we do the scan to see how many sacs are there inside the uterus and if the pregnancy is rightly growing inside the uterus or not. And from there on, the follow-up of the pregnancy starts. So this is about IVF.
Book your appointment on Pristine Care.